Welcome to another TT on the go. Today we are here at a brand new location, 5-year anniversary of Durham Spine Care and Rehabilitation Center. Our viewers, we hope you guys are going to enjoy this show. We're going to talk to the doctors, some of the staff, and find out what they're doing and how they can help you. Come with me, TT. Let's go. Hey guys, we're here with Dr. Ranjit Mahane. He just opened up a new location here on Ajax, and he has another location in Westney. So tell us, doctor, how has your journey been for the last 5 years when you first opened up your office?
Yeah, so thank you guys, first of all, for being out today covering this event. We opened Westney Spine Care 5 years ago at Westney and Kingston Road. Started off by myself, basically taking care of patients that had back problems, neck pain, headaches, and we have now grown to over 11 staff. And last year we opened up this new office, Durham Spine Care and Rehabilitation Center at Salem and Kingston Road. Mm-hmm. And this is more of a state-of-the-art technology office. It's focusing more on some advanced technologies in pain management. So here we have laser therapy, which is very good if you have tendinitis, if you have any sort of back pain, disc-related problems. We're using light energy now to help speed up the recovery of the tissues, and also spinal decompression. So a lot of patients now coming in with a disc problem or a muscle problem or a joint-related problem, we're able to use spinal traction to help pull the spine and alleviate a lot of that pain. So 80 to 90% of our patients are improving with our therapies, and to date we've seen over 2,500 new patients in both of our locations, and up till last night, we've delivered over 30,000 treatments in the last 5 years. So we're definitely proud of what we've accomplished. And this is not myself, this is obviously our team here of physiotherapists, chiropractors, psychologists, occupational therapists that work together in a team. And again, our objective, our goal is to improve the health of people that are living in this region. So. Thank you guys again for coming out here and covering this event.
Now, just a few more questions regarding the health and the rehab, aspect. So a lot of viewers and even myself, I have this concept in my mind that you should only go to rehab or acupuncture if you get injured, whether you're playing sports or on the job or something. But I know it's more than that.
Right.
It's more than that. And sometimes my dad comes home from work and he goes, "Oh, my back is hurting, my back is hurting." We're just like, "Oh, put on a Tylenol, you'll be okay." But you shouldn't ignore those factors, or you should never let go of that. So what do you have to say to our viewers who constantly have back pains or knee problems because that job endures them to stand for so long or sit for so long?
Absolutely. So when it comes to pain, we know that pain is the last thing to come and the first thing to go. So waiting till you have a problem is not the way to deal with things. Think of a dentist. You would go to the dentist preventatively to prevent the cavity in the first place. So for those who have back pain, first of all, it's very important to determine what the diagnosis is. You go to the doctor and the doctor tells you have back pain. We already knew that. So we need to look into that a little bit deeper. We need to look at what's causing the pain. Is it, like I said, a muscle problem, a disc problem? Once we determine the right diagnosis, then we can give you the right treatment. Okay. So what I would encourage people that are watching is, if there is pain, don't wait to the late stages, because we know the longer you have pain, the harder it is to treat. So when it's early, when it's acute, come on in, get some treatment. Usually you need about 6 treatments. Okay, and you should be feeling 80 to 90% better after those treatments. If you've had the problem for many years, then that might take a little bit more time. Okay. And for those who are just looking, that are playing sports or looking to just improve their health, absolutely, we recommend that they can come in on a maintenance basis if they're having a massage or having an adjustment, just to maintain alignment, maintain good muscle structure, function in their body.
Now, I noticed you have a lot of bone structures here. What are these things called?
Yeah.
So there it is.
I can show you right here.
Okay.
This is a good sample of a spine, and if you don't mind, I'll speak a little bit in Tamil.
Sure.
So let me just hold this over here. So உங்க ஸ்பைனை பார்த்தீங்களா, இதுதான் போன்ஸ். ஓகே, நடுவில் வந்து ஒரு டிஸ்க் இருக்கு. சில பேருக்கு வந்து இந்த டிஸ்க் வந்து ப்ரொலாப்ஸ் பண்ணும். ஓகே, you heard of disc herniation, disc bulge. இந்த pain இருந்தால் it's very painful. It's very painful. Kana perukku vandu night la padikkeladu and the pain vandu shoots right down their legs into their toes. Sila neram nadakave kastama irukum. So idukkudiya treatment vandu generally traction, spinal decompression. So இப்படி உள்ள ஆட்களுக்கு வந்து நாங்கள் ஒரு machine வச்சிருக்கிறோம் and it tractions their back. So by pulling on the vertebrae, we're able to alleviate that pressure on that disc. Okay, so you can see that red bulge there, and here's your nerve. And so and the சில பேர் சொல்லுவினம் விரைக்குது கால் இல்லாட்டி numbness, tingling. அப்போ இந்த பெயின் வர காரணம் நரம்பு வந்து கம்ப்ரெஸ் பண்ணிக்க தான் இந்த பெயின் வரும். So by doing some traction, we're able to alleviate some pressure on that nerve.
And you have testing, or you have the facilities here to check if you need decompression, right? Is that right?
Absolutely. So kanepe nekradhu x-ray venum, MRI venum, and a lot of the times you don't need those tests. Those tests are not necessarily going to show the area that they have pain. So ningal enga office ku verika mudalavadhu vandu we do a history. Just like you go to your family doctor, ennathal indha pain vandadhu, evlo naal indha pain ungalku irukku, rendavathu vandu how the pain is affecting their life. மூன்றாவது வந்து physical examination. So we do an examination where we do some tests. அப்போ இந்த டெஸ்ட் நாங்கள் இங்கே ஆஃபீஸில் சேர்க்க எங்களுக்கு தெரியும் என்னத்தால் கூடுதலாக இந்த பெயின் வருதுன்னு, இது நரம்பு சம்மந்தப்பட்ட பிரச்சனையா இல்லாட்டி மசோ சம்மந்தப்பட்ட பிரச்சனையா. Once we determine the right diagnosis, இப்போ அதுக்குரிய ட்ரீட்மெண்ட் நாங்கள் செய்யலாம்.
Well, you know what? Thank you, doctor, for all that information. And எங்களோட viewers, நீங்களும் கொஞ்சம் டிப்ஸ் லேர்ன் பண்ணியிருக்கேன்னு நாங்கள் ஹோப் பண்ணுறோம். ஆனால் உங்களுக்கு questions இதை பற்றி concerns ஏதாவது இருந்தால், please do reach out to Durham Spine Care Center. And ரெண்டாவது location, Westney and Kingston.
And we have this location at Salem and Kingston Road.
Thank you very much, and we hope to see you at another event, okay? வணக்கம் நேயர்களே. இப்போ நாங்கள் மிஸ்டர் சிவாவோட இருக்கிறோம். மிஸ்டர் சிவா வந்து டாக்டர் மஹேன்ட்டேருந்து ட்ரீட்மெண்ட் வாங்கினீங்கள். எவ்வளோ சீக்கிரம் உங்களோட கழுத்து நோ, பேக் பெயின் எல்லாம் உங்களை விட்டு போனது சொல்லுங்கள் பாப்போம் உங்களோட வியூவர்ஸுக்கா.
கழுத்து நோ வந்து எனக்கு ஒரு 2 ட்ரீட்மெண்ட்டோடைய எடுத்துடுச்சு. மற்ற இதற்கு நான் இப்பொழுது வந்து கொண்டிருக்கிறேன் அவரிடம். ஆனால் இதுக்கு 2 வருஷமாக போராடிட்டு இருந்தேன் நான். ஆனால் 2 வருஷம் போராட்டத்துக்கு ஒரு 2 வீக்ஸில் முடிவு வந்தேன்னா இங்கே தான்.
அண்ட் இந்த டாக்டர் மஹேன் ஆஃபீஸை பற்றி டிடிஆரில் பார்த்து தான் உங்களுக்கு இந்த இன்ஃபர்மேஷனே கிடைச்சேன்னு சொன்னீங்களே. ஓகே,
அதுவும் அந்த ஃப்ரீயாக போடக்கலாம் முதல்ல பார்த்து நான்.
ஓகே. இதுக்கு முதல் நீங்கள் பல வேறு டாக்டர்ஸ்கிட்டே நீங்கள் செக் பண்ணீங்களா இந்த ப்ராப்ளத்தை பற்றி?
மோர் தேன் 5 டாக்டர்கிட்ட செக் பண்ணியிருப்பேன்.
ஆனால் ஒரு சொல்யூஷனோ அதுக்கான ஒரு ட்ரீட்மெண்ட் உங்களுக்கு தெரியலை,
பலன் கிடைக்கல. ஆனால் காசு கொடுத்துருக்கேன், பலன் கிடைக்கல.
ஓகே. ஆனால் நீங்கள் டாக்டர் மஹேன்ட்ட வந்தபடியாக உங்கள்கிட்ட அந்த நோய் எல்லாம் உங்களை விட்டு இப்போ போயிட்டு தானே?
ஆமாம். அதோட இவர்கிட்ட சார்ஜும் வந்து விலை குறைவு. $35 தான் இன்சூரன்ஸில் அதாக எடுக்கிறார். மற்ற விட கூட எடுக்கிறார். மற்ற பேர் கூட எடுக்கணும். இவர் வந்து $35 தான் எடுக்கிறார். அதோட
ட்ரீட்மெண்ட் உங்களோட இன்சூரன்ஸ் கவரேஜ் எல்லாம் கவர் பண்ணி இப்போ நீங்கள் வந்து ஹெல்த்தியாக பெயின் ஒன்றும் இல்லாமல் இப்போ இருக்கிறீங்களா?
கழுத்தில் துப்புரவா பெயின் இல்லை.
ஸோ வியூவர்ஸ், நீங்கள் பார்த்துருப்பீங்க, இவரும் எங்களோட ஆட்டை பார்த்து டாக்டர் மஹேன் ஆட்ஸை பார்த்து தான் வந்திருக்கார். ஸோ நீங்களும் உங்களுக்கும் ஏதாவது ஒரு பிரச்சனைகளா, நோய்களா, பெயின் இருந்தால் இவற்றை வெப்சைட், ஃபேஸ்புக் பேஜ் இல்லாட்டி இவற்றை ஆஃபீஸ்க்கே நேராக அடித்து நீங்கள் கேட்கலாம். மீண்டும் ரொம்ப நன்றி.
Good afternoon, everyone. I'd like to welcome everyone for coming in today. For somebody to grow this far in a very short period of time, it takes a lot of focus and determination. So congratulations to you and for your full team.
I could not be here today, but he does send his regards. So today I'm just going to present a scroll to Dr. Mahin for his 5 years in business. And greetings on behalf of MP Mark Holland and Justin Trudeau. So thank you. So
Dr. Mahan, if I may, congratulations to you, to your wife Rita, and to the doctors and specialists and healthcare team that is here. Everything that you have done, including your activity in the community prior to your professional occupation here, has been one of an amazing story, and I know you'll go on to do greater heights. So I should also just mention the fact that you have come very, very close to almost treating some 40,000 treatments for patients. It's just amazing in such a short time span. So we tip our hat to you. I would like to bring this greeting from the province of Ontario, and that would represent all members of caucus. And the Premier knows I've been bringing this today. She is off on another escapade to bring more business back to Ontario. So as a member of Provincial Parliament for Ajax and Pickering, I would like to congratulate Westney Spine Care and Wellness Centre on the occasion of your 5th anniversary. It is a pleasure for me, representing all the members, to congratulate the owner / clinic director and chiropractor. Sometimes I stumble on the names, doctor, but I will try this. Dr. Ranjith Mahan, and serving over some count over 3,000 patients over the last 5 years. I wish you my very best for continued success and growth. I want to tell you, I have signed this in the Ontario Legislature, and I've attached the gold seal of the province of Ontario. And I know both of my friends bring special greetings for you because we do remember you. I remember you when you weren't quite old enough to shave. But you've come a long way, Doctor. So on behalf of everyone in the province of Ontario, I'd like to present that to you. And she's my boss.
டாக்டர் மஹேன் இப்போ வந்து டெக்னாலஜி எல்லாம் இப்போ வெரி ஃபாஸ்ட்டாக மூவ் பண்ணிக்கிட்டு இருக்குது. ஸோ புது ட்ரீட்மெண்ட்ஸ் புது டெக்னாலஜிஸ் வந்து இப்போ ஆட்களுக்கு ஹெல்ப் பண்ணுது. ஸோ எங்களுக்கு பின்னால் ஒரு மிஷின் இருக்குது. புது ட்ரீட்மெண்ட்ஸை பற்றி சொல்லுங்கள். என்னென்ன புது வேஸால் நீங்கள் எல்லாம் ட்ரீட் பண்ணுறீங்க கிளைண்ட்ஸுக்கு?
Yeah, definitely. So, treatment varega kana vityasamana treatments irukku. Acupuncture, spinal decompression, laser, sila therapy office ku ponningalenda or tingling machine mari ondu poduvinum adu pain ku. Ipo vandu lot of new advancement. Pudu technology ellam irukku pain management lendu. Engoda office vandu koodudala rendu technology, spinal decompression and laser therapy. In the rendu treatments are very safe. So there's no major side effects in the treatment sola. Majority of the time treatment ku perave avekku udane or relief theriyum. So adukudiya treatments vandu low risk with good outcomes. So mudalavathu treatment vandu spinal decompression. So idu vandu or decompression bed. Decompression என்னன்னா traction. இப்போ சில பேருக்கு நாங்கள் சொல்லுவோம், இப்போ எங்களோட ஆஃபீஸ் வந்து ஸ்பைன் கேர்ன்ற படியாக கழுத்து முதுகும் சம்மந்தப்பட்டது தான் மெயினாக செய்கிறோம் நாங்கள். பட் we treat shoulders, we treat knees, we treat elbows and wrists. பட் கழுத்து முதுகு சம்மந்தப்படைக்க மெஜாரிட்டி ஆஃப் த டைம் நரம்பல் வந்து ஸ்குவீஸ் ஆகுது, இல்லாட்டி ஆர்த்ரைட்டிஸ், இல்லாட்டி அந்த டிஸ்க் வந்து டேமேஜ். ஓகே, ஸோ சில ட்ரீட்மெண்ட்ஸ் வந்து சில ஆட்களுக்கு வந்து நாங்கள் கொஞ்சம் ரிலீஃப் கொடுக்கலாம். அவை வந்து அநேகமான ஆட்கள் மருந்தில் பாவிப்பினம், இன்ஜெக்ஷன்ஸ் போட்டிருக்கலாம், ஈவன் ஃபார் சர்ஜரி. அப்போ அதில் செஞ்சோன்னே இந்த ட்ரீட்மெண்ட்ஸும் அவை கண்டிப்பாக செய்யலாம். சில நேரம் இந்த ட்ரீட்மெண்ட்ஸால் அந்த ட்ரீட்மெண்ட்ஸும் குறைக்கலாம். ஓகே, ஸோ டீகம்ப்ரெஷன் டேபிள் வந்து for example, on a low back in the table, you would lie down on this table, it would traction around your pelvis and gently pull. So in the weights எல்லாம் நாங்க select பண்ணோம், உங்களோட body weight க்கு ஏத்த மாதிரி select பண்ணி அந்த table slower traction பண்ணோம். Okay, ரெண்டாவது ட்ரீட்மெண்ட் வந்து laser therapy. So laser therapy வந்து another light. சில பேர் வந்து ultrasound பாவிக்கிறது. Laser வந்து இப்போ it's the new frontier, the new way, exactly. And in the lasers the heat on the middle, so it's not going to burn you, it's not going to scar you. There's no
laser and
payam, exactly. So there's no known side effects to these types of therapies. again, நீங்கள் எங்கள் ஆஃபீஸுக்கு வரைக்கும் we would first examine you. உங்களுக்கு என்ன ட்ரீட்மெண்ட் முதலாவது நாங்கள் டிசைட் பண்ணணும். சில பேருக்கு மேபி லேசர் may not help. அப்போ அதுக்கு அந்த டயக்னோஸுக்கு ஏற்ற மாதிரி தான் ட்ரீட்மெண்ட் செய்வோம். ஸோ ஃபார் எக்ஸாம்பிள் இப்போ உங்களுக்கு எல்போ பெயின் இருந்தால் ஆனால் நீங்கள் ஸ்குவீஸ் பண்ணுற நீங்கள் வேலையில் வந்து you use a screwdriver, a lot of repetitive work at the computer. You had asked me about that earlier. இது வந்து நாங்கள் சொல்கிறது repetitive strain injury. Okay, so கண்டிப்பாக அதுக்கு நீங்கள் ரெஸ்ட் கொடுக்காட்டி பெயின் கூடும், டிஷ்யூ சில நேரம் டேமேஜ் ஆகும். ஸோ அந்த டிஷ்யூவை ரிப்பேர் பண்ணுறது தான் லேசர். ஸோ we would take the laser probe, place it right over the elbow, and we would set the laser power. So depending on the tissue that we want to treat, we will decide how much power we'd like to use and the time. Okay, and treatment was about 10 to 15 minutes. And on the 10 to 15 minutes, we'll go to difference study. And it's promoting a cellular response in the body. Okay, idola nangal vera treatments seyalam, stretches, exercises, and using other modalities to help those as well.
Thank you very much, doctor. And once again, எங்களோட viewers, உங்களுக்கு questions, ஏதாவது concerns, ஏதாவது உங்களுக்கு help பண்ணணும்டா, இல்லாட்டி உங்களுக்கு தெரிஞ்ச ஆட்களுக்கு ஏதாவது ஒரு no pain இருந்தா, please do reach out to Durham Spine and Care, so they can find out more helpful ways to treat you guys. So thank you again, doctor.
Thank you.
We don't have the budget that the province has. So it says, Wesley Spine Care and Wellness Center, congratulations from the town of Ajax in recognition of your 5th anniversary. As mayor of the town of Ajax, it gives me great pleasure to extend heartfelt congratulations and best wishes on this very important occasion. So on behalf of all members of council, congratulations.
It's a true story. The amount of time that Dr. Maheen put effort towards his internal and external his customers, the way he took care of his associate, is more than anything else. You can simply see that business is about to grow. I sit back there and listen to all the conversation all the time because I can't shut down my ears. And the patients, most of the time, they sit and wait and say, "Oh, I'm going to be the next one. I'm waiting to see Dr. Maheen." That much of encouragement from each and every patient, they're waiting to see him. Money is not the issue over there. The wellness, how they can get back to their normal life. Congratulations, keep doing your job, and there is no limit, young gentlemen. It's going to grow like crazy.
Hello guys, with TT on the go we have Christiana Iggy. She's a registered nurse for over 30 years, and welcome to TT on the go set, and you are here today at Durham Spine and Care. You came in to explain a few things and different treatments that patients are now allowed to. Now I'm going to ask you a few questions. Now you've been a nurse for over 30 years and you've seen the types of cases that come in, and obviously the world is changing, our work is changing as well. And how do you think acupuncture and physiotherapy and rehab help patients nowadays?
Actually, today's world, with all the things that we are exposed to, chemicals and the poor food state, the nutrition state, we are finding that we are now fighting with a lot of chronic diseases. Before, type 2 diabetes did not happen in younger people. But today, so many people have been diagnosed with diabetes. What is it that is causing all these problems? It is because our bodies are being bombarded and we're not having a fighting chance. So we need to be able to prepare ourselves with the right supplements, because even Hippocrates, the father of medicine, said, "Let thy medicine be thy food and thy food thy medicine." But the food that we eat is causing us more problems because they've been genetically modified and we are getting a lot of fake food. So these are fighting against our immune systems. So we need to actually turned to pure nutritional supplements that can help our bodies repair and rebuild and sustain. So I was talking earlier about NutraMetrics. NutraMetrics is a customized wellness solution that is made for medical clinics, for doctors to help their patients, so that even if you are not seeing your doctor regularly, you have that maintenance. Because if you don't input good nutrition, you will not be able to get the benefit of health.
That's true, definitely.
Yes.
And you have 2 boys and a daughter, and your 2 boys are very athletic, and they're playing basketball. And what was the other one playing?
It was a track athlete.
Track athlete.
He just graduated.
Just graduated. So they do a lot of running, a lot of jumping, and I know you were talking to Dr. Mahane about bringing them in and getting them checked out. Tell me why it's important for athletes to check out these type of facilities even before they run into any injuries.
Actually, again, prevention is better than cure. What you sow, you will reap.
Exactly.
So I believe strongly in that. I believe more in the maintenance and preventative part of medicine. So with my boys, they go through a lot of wear and tear. They get Gatorade. What is that? Sugar. They lose so much. They used to say sweat is just salt and water, but sweat is everything in your blood. So if you're sweating so much, you don't replace it, you're going to be in trouble. As well, your body needs to be reconditioned. That is where the chiropractor comes in. That is where the acupuncture comes in. You see, you've heard about people dropping dead in gyms. So just exercising is not all you need. It's a whole total holistic care for your body. So
Thank you very much, Christiana, and thank you for letting us know about the knowledge behind these type of nutrients and preventative measures that we can all take. So our viewers and our athletes that are watching this right now, you guys play basketball, football, summer's around the corner. We don't want you guys getting injured. We want you guys to stay healthy and perform at your best. So if you want to just come in, check out, get some more in-depth knowledge about how to prevent yourself from getting injured, please do reach out to Durham Spine Care and Rehab Center. Thank you guys. Thank you very much. Hey guys, I hope you guys enjoyed today's segment of TET on the Go. We had a great time. We learned a lot, and I hope you guys learned a lot too. If you would like to know more information about acupuncture or therapy or rehab, please do reach out to Durham Spine Care and Rehabilitation Center for all that and more. And we hope to see you at another TET on the Go checking out right now. Bye-bye.